Okay, I'm doing Chapter 25, Question 1. What is telehealth? And why does the ANA prefer the term telehealth rather than telemedicine? And what types of things can healthcare providers do with telehealth? Telehealth is the use of telecommunications technologies and electronic information to exchange healthcare information and to provide support services such as long distance clinical healthcare to clients. It includes health promotion, disease prevention, diagnosis, consultation, education, and therapy. It can cross both social and geographic barriers. It's great for rural areas and also geriatric patients, people who can't get out, like even wheelchair or homebound patients. Computers, phones, interactive video, and teleconferences such as Skype can be used, which is good. It's easy. The ANA prefers the term telehealth over telemedicine because it is more inclusive and a more accurate description of the services provided. I think the term telemedicine can be confusing to a patient and possibly lead them to mistakenly believe at times that a physician may be supplying care instead of maybe possibly a nurse. Um, and that may not always be the case at all times. So they may not have a physician. Um, Physicians can also use telehealth to collaborate with other healthcare providers, conduct patient interviews, assess and monitor patients, review labs and tests. Time management it can be increased. Obviously, it's easier than actually having the patient come in and having them wait long in the waiting room and all that. So decrease both hospital and office visits for patients and chronic diseases. Access patients or assess patients that are more susceptible to isolation and loneliness. Think about uh, people who are, like I said, homebound. They're more likely to be isolated and have loneliness, um, like geriatric and rural patients. Apply education as needed. Improve case management services and improve the quality of the patient care. Improve overall quality of the patient's or the client's records. So, I mean, there's all those can be done very easily and managed very well. Now, the only bad side would be, I'm not adding this in there, but is that what if the patient doesn't have access to a computer or technology? Then that would be a hindrance, of course. But otherwise, it's usually a win-win. Um, or if they don't have the knowledge to um, use the technology. Maybe they don't have the educational background to actually use the computers and the technology. I think it's really cool as a telemetry nurse. I always think about how patients have pacemakers, and now they can just phone in and have them check their pacemakers. I've always thought that was awesome. Just kind of cool. But anyway, that's my part of the telehealth. Thanks.